Now we have to understand one basic concept, it is Berry Aneurysm. Before understanding the intracranial bleeding, we have to understand how the bleeding is occurring actually. Any kind of bleeding, whatever is happening, any kind of bleeding, the bleed is actually going to come out of blood vessel only, right? Where it may be artery or vein, it is going to come out of vessels only, right? Blood vessels only, right? So how it is actually occurring? See, in blood vessels, we imagine that this is blood vessel. In some of the areas, the walls of the vessel will be weak, like this. So it is not strong enough. So, you would have played with the balloon sometimes. So when you blow air inside the balloon, in weak zones, the balloon will explode a lot, will stretch out a lot, and the air will be more accumulated lot than when compared to the other areas, right? So at that point, the balloon will actually explode like this, right? But it is for short time only. After for prolonged period of blowing of air, when you're trying to blow more and more amount of air inside, actually in due course, within some few minutes, the balloon will explode. That exposure, that will explode actually will happen at this point, because the wall of the balloon will be very weak only at this point. The same way, the blood vessels also, sometimes it may be weak at certain points, certain areas, right? At that area, the balloon will become, the blood vessel will become protruding like this because of the flowing of blood due to the hypertension. The blood will be accumulated over here, here and here for a long period. Okay, it will be accumulated, and in due time it will be stretched out like this. It will be stretched out like this. Sometimes it may produce a enlarged structure like berry. It will be like a berry. Why they are saying is berry means it will be dark red color. Sometimes it will maybe in dark violet color. So they say berry. Berry will be in that color only, right? So berry, okay? So because of this accumulation, the particular area will be protruded like this and it will form like a berry-like structure. So they call it as berry, okay? And it will not be like this all time. Due to pressure, it may be ruptured at one point, right? So the blood will escape out of it. So it will occupy the entire area. So the same will happen in the brain also, right? So why we are speaking about that now? Because everywhere it is occupied by blood vessels. The major blood vessels are going to supply to the major area, right? The anterior cerebral artery, posterior cerebral artery, middle cerebral artery, and communicating arteries anteriorly and posteriorly, then posterior cerebral artery. All these arteries are going to supply for particular areas. Some particular arteries are going to supply. When this is going to happen, right? That particular area for which this particular artery is going to supply, that artery, that area is not going to get enough oxygen or enough nutrition. So ultimately, that is going to form necrosis. So due to that, the cell death will occur. So penumbra, this is what happens. Okay, so this is the basic concept behind the hemorrhage. Okay, once this is happening, the blood will leak out of that and occupy the entire area. One thing is, it will actually destroy the, it will actually produce ischemic effect to the particular cells, which is across this particular border. But actually what is happening inside this area, inside that area, the fluid will get into the cells, and actually those cells will go for bulging. So intra-extra cellular exchange will not happen, and those cells also will go for dying. So there are two things are happening. One thing, bleeding. So it will cause hyperperfusion of the cells. How? These blood, the plasma or the fluid which is present in the blood will enter into the cells, and it will be already having hyperperfusion, right? So there is no intra-extra cellular exchange happens. So homeostasis will be affected. So there is no nutritional exchange. So cell death will occur. This is one phenomenon. Second phenomenon, the borderline area. Beyond this, there is no nutritional exchange. How? Those cells are not actually affected. But the point is, because of this, see, there are a lot of hemorrhage here. That hemorrhage itself will compress the local blood supply. Suppose if there is any artery here. This hemorrhage itself will go and compress there, right? So both this one as well as this one, the entire area is going to get affected. This is the drawback in the intracranial bleeding. Okay, this is the drawback, and this is the drawback behind the intracranial bleeding. And why this is happening? That is because of Berry aneurysm. Okay, this is what Berry aneurysm. Okay.